Call this meeting of the Blackhawk County Board of Supervisors to order. Roll call, please. Mr. Veeder.
Leyland,
Here.
Little,
Here.
Jelka,
Here.
White,
Here.
Schwartz.
Here. Please join us in a moment of silence to reflect on today's actions. Please join us for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So do you have a quorum for the Board of Health? All right, do you want to call your meeting to order too then?
I will now call to order a special session of the Blackhawk County Board of Health in joint meeting with the Blackhawk County Board of Supervisors. With those who are on the Blackhawk County Board of Health, identify themselves and their presence.
Hi, Dr. Catherine Zeman.
Dr. Adam Royce, present.
I saw Beth.
She is. Her name's up there.
Yeah, her name. Beth, can you unmute yourself? There you go. But you have to say something. Well, we do have a quorum, and Beth, we can't hear you.
Does look she's muted.
Okay.
Is it, do you show her unmuted?
She's not muted. She wasn't.
All right.
Beth, if you're talking, we cannot hear you.
All right, should we just continue on
Yeah.
our agenda?
Do
Okay.
quorum.
I'll take a motion on the agenda as received or as amended.
So moved.
Second.
It's been moved and seconded. Any discussion or questions? Hearing none, all those in favor say aye.
Aye.
Aye. All those opposed? The agenda is approved. Next is recognition of the West High School Men's Bowling Champions, the East High School Women's Bowling Champions, and the Don Bosco Men's Wrestling Champions, as well as the Don Bosco Men's Baseball Champions. We would, of course, normally do this in person. We invite the teams in, and it's great. But today we're doing this virtually. So if any of the coaches are online with us today and wish to unmute and say a few words, we certainly applaud your great performances this year.
Coach Hogan's there.
But Coach Hogan, would you like to say something?
He's muted.
Oh, we can't. I know you unmuted, but we still can't hear you.
Do,
Well, again, we congratulate you on a really great season. Sorry for the technical difficulties, but again, send our congratulations to all of your team members. Next, we will move on to public comments. Anybody from the public wish to speak to something that is not an agenda item at this time? All right, hearing none, we will move on to claims and payments.
Supervisor Schwartz?
Yes.
Okay, hi. I did not know if this was the place, the spot where we would talk about our concern for our children that are returning to school. But I did want to express my fear and anxiety and angst as we prepare for our children and our teachers, parents, administrators, and et cetera, school this fall, given the fact that our numbers are not where they need to be, that we have a 15% cap as far as where we must go in order to consider um, virtual alternatives for our children, and we're at 8 to 9% right now. CDC's requirement is 5% to determine, to close things down, and some cities are lower than that, and we're right now at 8 to 9. I am concerned that when our children return to school, they would not only be infected with this virus, but they'll take it home to their parents and grandparents and the rest of the community. And we know that communities of color have been hit the hardest by this virus proportionately, given that too many of us are workers, frontline workers, right? Working low-wage jobs and jobs that place us at a greater risk for infection. So these children come from those homes and will find themselves at a greater risk of infection and then sicker because of the way in which the healthcare system operates as it relates to children and people of color. So I wanted to share my concerns, my fears. Even as a congregation, we have not opened our building up. We're still doing parking lot services for fear of infection, and I don't want anyone's blood on my hands, so to speak, because of this pandemic that we find ourselves in. So me being conscientious and caring about the life of those that have been entrusted to my care, it would be my hope and prayer that somehow together we can let the powers that be, whether it's the governor or whatever, let them know that we need something more, a better plan in place for our children, given the condition right now of our state and our city in particular, and our county in particular. So thank you for hearing me.
Thank you, Reverend Clayton Smith. And we will be discussing a little bit more on this further down in the agenda, but I thank you for your concerns, and I share them. Next is claims and payments. James?
Good morning, James Perry, Finance Director. Expenditures this week, $540,339.53. The larger items: Sheriff's Department $324, $545. Maintenance Department $15,361. Secondary roads $88,533. Social services $10,557. Everything looked normal. So.
All right, I'll entertain a motion to approve.
So moved.
Second.
All right, it's been moved and seconded. Do we have any discussion or questions? Hearing none, roll call, please, Mr. Veeder.
Leyland,
Yes.
Little,
Yes.
Jelka,
Yes.
White,
Yes.
Schwartz.
Yes. The resolution is approved. Next, we'll receive project updates from department heads and elected officials. Good morning, Kathy.
Morning.
Kathy.
Good morning, Board. Kathy Nicholas, County Engineer. Just very briefly, I want to let you know that we did not sustain any storm damage, at least to the road system or our secondary roads facilities yesterday afternoon. And I also wanted to let you know that PCI, Peterson, will be pouring the last pier cap this morning. So this would be on the Cedar River Bridge replacement project. And we're hoping that by next Tuesday or Wednesday, they will be setting the beams on that west side of the bridge. And I'll keep you informed because I know some of you might want to go out and see that. So that's really good news. And then that's all I'd like to report. Any questions for me? Thank you.
Thank you. Any other department heads or elected officials wish to give a report today?
Good morning, Board. This is Yolando. Can you hear me?
Yes.
I'm Yolando Lovelace, Blackhawk County Veterans Affairs Director. Just want to give you a quick update on how things have been going since we moved into our new facility. First and foremost, my thoughts and prayers are out to the folks in Des Moines, Cedar Rapids, and those other areas that were hit by the storm. Just real quick, last night we housed a veteran in Motel 6, a homeless veteran in Motel 6 who was evicted from his current resident and needed a place to stay. And so I authorized that in that standpoint. For the month of April, May, and June, we averaged about 76 veterans coming in our door and about 13 new veterans a month. Just last month alone, for the month of July, we had 124 veterans come in our door. Out of that 124, 72 were walk-ins, meaning they didn't have an appointment. They just just came in, and which we like to see. And of those 124, 24 of them were brand new. Of that 124, 10 of them were female veterans, and we processed 5 PTSD claims. And out of that, we continue to see a double or triple digit increase. And what I mean by increase is our Vietnam veterans are the most that we serve. We served 46 of them last month alone, and we continue to put a spotlight or focus on our Vietnam veterans. In particular, just last month alone, our Vietnam veterans, one brought in $123K in a compensation claim, and another brought in $23,000 initial on his compensation claim. So we really are impressed with what the VA is doing as they compensate our Vietnam veterans. And then we had 11 from other counties. Later today, I'll be participating in the National Guard's monthly family readiness group. They're doing Zoom meetings once a month as those, the 133rd is downrange, and they asked us to participate in that to provide any kind of advice and assistance. And this is our way of interacting with the National Guard as those soldiers are downrange. A couple other big things that stands out is we have 2 blood drives that we're setting up. I just really feel that it's our duty as veterans and as citizens, after we see 165,000 Americans perish due to this pandemic, that we try to do something to give back. So we have a blood drive scheduled for the 18th of this month here at the Pinecrest Building in the chapel. And then on 9/11, we are also hosting a blood drive in support with the fire department to do something special there, where you're going to have veterans and the fire department, first responders, working together to do a blood drive. So we're looking for donors to help support this much needed venue. Later today, also, we have to attend another Vietnam veterans funeral. This will be the 3rd in the last 2 weeks as we continue to support our veterans even during the time that they transition. And last but not least, we are very happy in our new facility. We're getting a lot of great comments from the veterans that are coming into our new facility, and really it's just there to service them in our office spaces. But we are really happy at what we are, and we just thank you guys for giving us the opportunity to move from our present facility into our new one as we look to expand eventually sometime after the pandemic. Because as you know, we haven't been able to do any outreach. We haven't been able to do any ramps, anything that we normally would do to help bring veterans in our doors. But yet, by word of mouth, our veterans are still coming into our office seeking assistance and getting assistance to the best of our ability. Standing by to address any questions or concerns.
Thank you, Londo. Keep up the good work.
Yeah. Thank you.
Any other department heads or elected officials?
Chris, Mike Hendrickson, Director of County Conservation.
Yes.
Just very quickly wanted to let everyone know, at the courthouse anyway, our phones are down here at the office. So if you're frustrated trying to get through, that's why. And I know we're getting some emails from the public wanting to know why we won't answer our phones. But the phones are down. We've called it in. We called it in yesterday. So we hope to have service later today, but just a heads up on that. We have had some damage, tree damage in our south units from the storm yesterday. Hickory Hills has some trees down, but it doesn't sound like any structural damage, and the crews are cleaning that up. And we've got some trees down on the Cedar Valley Nature Trail, and we actually have 2 crews working this morning one going north, one going south, and so we hope to have that open back up by the end of the day. But so I'm going to go down and check those things out here shortly. So that's all I've got.
Thank you, Mike. Any department heads or elected officials today? Hearing none, we will move on to the minutes approved from the August 4th and August 6th meetings.
So moved. Second?
It's been moved and seconded. Any discussion or questions? Hearing none, all those in favor say aye.
Aye.
Aye. The motion is approved. Next, we will move on to the consent agenda. This will be approved with a single resolution.
So moved. Second?
It's been moved and seconded. Is there anything in the consent agenda anyone wishes to discuss? Hearing none, roll call, please, Mr. Veeder.
Little,
Yes.
Trelka,
Yes.
White,
Yes.
Leyland,
Yes.
Schwartz.
Yes. The resolution is approved. Next, under contracts and agreements, this is the resolution of the 28E agreement between Blackhawk County and 19 Iowa counties: El McKee, Blackhawk, Bremer, Buchanan, Butler, Saragota, Chickasaw, Clayton, Delaware, Dubuque, Fayette, Floyd, Franklin, Grundy, Hancock, Howard, Mitchell, Winnebago, Winneshiek, and Worth to appoint chief elected officials to oversee the Northeast Iowa local workforce development, be approved, and for the chair to sign.
So moved. So moved.
Second?
It's been moved and seconded. Any discussion or questions?
I'll be voting no on this because, due to the fact that years ago, the governor found it necessary to downgrade the working men and women of the state of Iowa by not allowing them to be chair people of the boards.
Oh, and just for informational purposes too, from the local workforce development board, they are going to be included, the union workers and stuff on there. So that correction is noted. Thank you, Craig. I think hopefully I'll have information to the board to kind of explain a little bit about this. It's something we've been working on for years. It started with a realignment that needed to be necessary. We had 15 workforce development regions in the state, and the Department of Labor came in and did some investigation and said there were some things that we weren't doing as a state that we needed to do to continue funding. And so one of those has been a realignment, and what we were is 15 regions, and our region had 5 counties. We are now, as a region, having 20. So hopefully we can, like I say, this is the first step, the 2080 agreement, and we've worked on it for quite some time. The second step will be the fiscal agent and then staffing for it that we have to work on yet, but appreciate everyone's approval or support of this going
Some of
forward.
those counties that you're working with are the ones that we had trouble with mental health, so
I know.
good luck with that.
I know. Hopefully, they're all supposed to be approved this week, so if not, we'll find out. Thank you.
All right, any further discussion or questions? Hearing none, roll call, please, Mr. Veeder.
Trelka,
Yes.
White,
No.
Leyland,
Yes.
Little,
Yes.
Schwartz.
Yes. The resolution is approved. Next, under other business, this is discussion, possible board action, to discuss county preparedness for COVID-19. This is a joint meeting between the Board of Health and regarding the proclamation or possibly or discussion about wearing a face mask and mouth and nose coverings to slow the spread of COVID-19.
And I was just
Right.
going to comment to Mr. Veeder that Wes Pilkington is the 5th board member for the Board of Health, and he is available on site now. So he would be included in our attendance.
Okay, I'm not taking minutes for the Board of Health as far as I understand, so
But you did that. Did you include those people in our?
no, I did not.
You did not? Okay.
No. If you would like that as a matter of record in ours,
I would think I would like that in ours as
Okay.
well.
yes, if you give me a list of names, I appreciate it. Thank you.
The list too.
All right, very good. Go ahead, Dr. Robinson.
Good morning, Board.
Good morning.
We have come before you in the past about different issues, and I can't think of a more important one than the one that we're going to deal with today. And that is the possibility of having a face covering regulation or ordinance, as some call. The Blackhawk County Health Department is responsible and accountable through collaborative efforts for planning and policy development, and we promote population health, prevent disease, and protect the environment of all of the county residents and visitors. And of course, this has included all of the efforts, the magnificent efforts of the department with respect to COVID-19 and helping to stop that spread here in the county. And as I thought about coming before you today with our board, and I would like the opportunity for each of our board members who are all present to make any particular comments that they wish, because we all bring different expertise and different passion to this work. But I wanted to, just for the record, to talk about, first of all, the public health core functions, our 10 essential services, and how this relates to COVID-19 and the stop of the spread. First of all, our first core function of the health department, we are to assess and to monitor and do surveillance of local health problems and the needs. And then we are to try as best we can to provide the resources for them. And we are to monitor health status and understand the health issues facing this county. We are to protect people as best we can from health problems and even health hazards. We are to, under core function number 2, we are to give people the information that they need in this county to make healthy choices, and to engage this board and the community to identify and solve the various problems. And certainly last but not least, we are to enforce public health law and regulations. And so with that, as I thought about what we're going to request today, or at least inform you today, that the Board of Health, we are looking at the possibility of passing an ordinance, passing a regulation, because we think it's more than time. We think that we have been patient, beyond patient, and we do believe that patience is a virtue, but there can be a point to where we can become so patient until we do nothing, and it impacts the health of this community. Anyone can go to our website and can see that we've had 3,700, as of yesterday, 750 reported cases, and 3,128 positive. But what bothers me the most is the 66 deaths that we've had, and increasing. For some time now, we have waited, the Board of Health, many of the boards of health across this state, we have waited for our state government to take stronger measures with respect to our particular counties. We are, if my numbers are correct, the 5th largest county in the state, and we are being treated on par with other counties that don't have the records and don't have the numbers of illnesses, positive cases, or deaths that we have. There's something about that that's just unfair. It's not right. And we are the ones that are responsible for our county, Black Hawk County. And so, to me, that's a very serious thing. And since last Tuesday through yesterday, just the week ago that I was here, 123 new reported cases, and as I said, now up to 66 deaths. Each of these cases, these people are interacting with everybody else in the county. Whether it's when they go grocery shopping, or when they go to work, or when they go to social events, or wherever they go, they are interacting. And so each person, each of these cases that are reported, they have the potential of interacting with anywhere from as little as 5 to hundreds of individuals. And we already have community spread, and so that just increases of that potential. And so the Board of Health, we feel we have three choices. One choice is to do nothing. That is a choice, and hope for the best. But this is not an option for us, and it is in violation of, first of all, our law. We are responsible to the Iowa Code for certain things. It is in violation of our duty to protect the health. It's in violation of who we are, our consciousness, and then it would be immoral. And then we have another option, and that would be to submit a proclamation to the governor, asking the governor once again to do what we consider to be the right thing. We have, not just our board, but other boards have submitted various proclamations, and to date, they have not gone, well, in our opinion, they haven't really gone anywhere, sometimes not even responded to. And so this really is almost tantamount to nothing, in my opinion, because it makes us begin to feel as if we're doing nothing. And then we have a third option, and that is to take stronger measures within our own boundaries, because we know our people best, based on solid evidence and caring for those who are the most vulnerable to this disease. And you know what? Many times we think we are not vulnerable, the most vulnerable, and we have seen that this disease knows no gender, no age. It attacks everyone. And so we're all, in some sense, vulnerable. But I also think about what Pastor Belinda said, and she's absolutely 100% correct. Those who are the most vulnerable, those of color, those over certain age groups, those already with certain health conditions, I really wonder what we're saying to them when we do not take stronger measures to protect them. We're really saying that they really don't matter in one sense. While we can pass an ordinance, we certainly can within the law, and Mike can tell you more about that. We need your support. We need you to be hopefully on board with us, not just for the unity's sake, but so that we can all join together to show this county how much we care. We all know we care, but just how much we care. We're all in this together. What affects one of us affects all of us. And it will be a beautiful partnering and joint effort to let those know just where we stand, and that if there are some policies or if there are some things that need to be changed, that they are important enough for us to make those changes. And finally, I just want to conclude that I do believe, I have no idea who said this, but I've heard it all my life, when we know better, we do better. And we cannot say that we don't know the statistics, and they're not statistics, these are people. And so we do know better. We cannot claim ignorance. And so I come before you asking that you listen with your heart as the Black Hawk County Board of Health proceeds forward. And Mike, I think do you want to go first, or do you want me to let the board?
I'm here to answer questions
Okay.
regarding procedure and legality if they come up.
Okay.
But I'm not here to discuss the ordinance itself at this point, except as to the legalities.
Okay. Then I think I will turn it over and ask if there are any members of the Black Hawk County Board, we're represented in full, would like to make a comment at this point.
I would like to make a comment, Reverend Mary. Thank you for the points that you just made.
Dr.
I think
Zeman,
it's very.
Would you
I'm
mention
sorry?
your name, please, for the record?
Yes, thank you. Dr. Catherine Zeman, Black Hawk County Board of Health. I echo the concerns that Dr. Creighton Smith made, and also that you pointed out, Dr. Robinson, concerns about, 3/4 of the MIS-C patients and children, according to CDC data just released prior to the weekend, have been found to be Latino and African American children. They also have an 8 to 4 times higher hospitalization rate than Anglo children. And if we're going to open schools and have a 15% gate on when we might decide to slow things down and shut down schools, that's very concerning to me that so many Latinx, African American children are being impacted this way. MIS-C, some kind of interference on the microphone here. Did it, okay? MIS-C is the multi-organ inflammatory syndrome in children, can affect kids. There's several hundred, almost 600, I think, was noted in the article prior to the weekend. The other issue that I just want to point out today that kind of indicates that maybe our mask ordinance is a little overdue. I know a lot of people know Dr. Michael Osterholm. He is the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. He's very well known throughout the country and fairly renowned epidemiologist, has done much accurate modeling. He is predicting a serious wave of infection that will rival what we saw over the Memorial Day holiday as a result of opening schools. He and the president of the Federal Reserve branch in Minnesota just published a New York Times editorial talking about this modeling and jointly calling for another countrywide shutdown. So I think the idea that we would require people to cover their faces in order to give the schools at least a fighting chance to be open safely and equitably, I think is a very important thing we should all think about. Thank you.
Thank you. I see Dr. Ross, you have unmuted yourself.
So I'm Patton Royce, I'm a family physician in Waterloo. As I think about where we're at with COVID right now, and as I think about the tools that we have to fight this pandemic, I think I want to agree with what's been already said, that we can shut everything down, we can wear masks, we can socially distance. And out of those, if we're going to keep our schools open, if we're going to keep our businesses open, if we're going to keep our communities open, the one thing we have to do as a society really is to do the one thing that we really can and that each of us is able to do. Unfortunately, we've seen too many people who aren't wearing the masks. And I think as a physician, that's the one thing that helps me in my job take care of patients. That's the one thing that helps me and my family take care of each other is to wear masks. And as has been stated, and as Dr. Creighton Smith put in the chat, the American Academy of Pediatrics reported that 97,000 kids in the United States in just 2 weeks, in the last 2 weeks of July, tested positive for COVID. As we go into schools, even if schools are mandating that masks be worn, I think it behooves us to involve more of our community and our society, all of our community and our society, to work to keep each other safe. And I think that taking an action by our boards is the best way to do that.
Okay, great. Thank you, Dr. Rice. I saw, if there's anyone else from the board, okay, Wes, I see you. Okay, go ahead.
Yeah, I don't know if Beth wants to say anything. If you can give me just a second here, I just need to step into my office.
Okay. Beth, oh, there you are. You're unmuted again. Were you trying to say something? I think she probably is having problems. Well, while we wait for Dr. Pilkington, go ahead. I see you're back. Go ahead.
Okay, I'm ready. Thank you. Sorry about that. I'm Wes Pilkington, and I'm a pharmacist at Evans Crossing Pharmacy in Evansville. I'd like to thank the Board of Supervisors for allowing discussion of this topic. As we know, this is a novel virus we're dealing with, and what that means is we're learning as we go. As we gain more information about the virus, we learn how to better prevent people from spreading and contracting it. One of the major things we have learned is the use of masks, face coverings, and or face shields are effective at lowering the risk of spreading the virus. There have been various articles in prestigious medical journals that point to evidence to support this. As a mask mandate is critical to help control the spread of the virus in Blackhawk County. The point of the mandate is not to search out everyone without a mask and issue fines, but rather encourage more of our citizens to wear face coverings. We have an opportunity to make a direct impact on the health of our community, and I thank the Board of Supervisors for prioritizing public health in this matter.
And I see we have a message from Beth.
Come across the screen up there, Doctor.
Oh, it's showing?
Yep,
Oh,
it showed
I
up.
can't see it.
Yeah.
What does it say?
Said she supports everything that's been said.
Oh, okay, awesome. Thank you, Beth. And with that, parts of the what we are proposing, and thank you, board. Thank you once again. We have been struggling as a board. It has not been easy for us, and we did not reach this conclusion lightly. It's based upon evidence. It's based upon our own experience that we have seen in this community. And so what we would be asking is that every person in Blackhawk County to wear a face covering when they are in public, as opposed to being in one's place of residence, when one cannot stay 6 feet away from others. We're asking for this to be done inside of any indoor public settings, for example, but not limited to, grocery stores, pharmacies, hardware stores, retail stores, schools, and other public settings that are not one's place of residence, and when you are with persons who do not live in the household. Outside, if keeping 6 feet away from others is not possible, or using public transportation or private car service, including taxis, ride sharing, and carpool. And we will be taking this up at our next meeting, and we'll be proposing that we present it and bring it back. I believe that's...
And my understanding, Reverend Mary, is that that there may be a motion to set a public hearing, and if so, that public hearing should not be set until at least Wednesday of next week due to publication requirements for necessary notice under the Iowa Code.
Okay. Now, do we, as the Board of Health, need to make that motion right now, or when we meet?
That can be made today, but otherwise it would take another meeting in order to have that motion to set that. So if you want to have that next week, today would be the time to make the motion.
Okay. Board, you have heard the comments of Mike, the board attorney. Is there any discussion? Hearing none, I will entertain a motion that we, what was it again? That we
Set a public hearing.
that we
for
set the
Board of
public
Health.
hearing for the Board of Health.
Yep.
So moved. I move you set a public hearing for the Board of Health.
Second.
Second.
Okay. It's been properly moved and seconded. Further discussion? Hearing none, all those in favor, please signify by the sign of aye.
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 Those opposed? Abstentions?
And the one thing that would also need to be done is you would need to figure out when people are available for that hearing. And like I said, Wednesday of next week would be the earliest that we could have it. And if you would want to have some determination by the Board of Health brought before the Board of Supervisors by the week after next, because ultimately, if you are passing a regulation, it needs to be approved by the Board of Supervisors in order to become law. You would want to have that by or before Friday, so I realize that's a small window, and otherwise it would just kind of push it off a week because you need time to get on the Board of Supervisors agenda.
Okay. That sounds good. Thank you for
All right,
instructions.
who do you see enforcing this?
Yeah.
All right, right now, the way that the only county that I'm aware of who has such an ordinance right now is Johnson County.
Right.
They've made it punishable as a simple misdemeanor. My understanding is that they're having local law enforcement do it. So it can be police, sheriffs, whoever gets reported to as law enforcement. It could also be the health department that would enforce this because it's under their purview. But the way I understand the Johnson counties to work is that they're having local law enforcement do it.
Right.
And that's because they're out and about seeing people
I
and
understand
answering
that.
those.
Understand.
And they just passed that? What date? When did they do it?
did. So the Board of Health passed it down there. It was week before last that they passed it. In fact, I communicated with their county attorney's office. It would have been right about the end of July on that. And then the Board of Supervisors approved it, I believe, on Thursday of last week. It was either Thursday or Friday, I believe. And they approved it by a fairly detailed written resolution that can be found on the Johnson County website.
I think it'd be wise to have the sheriff of Black Hawk County here then, because the people at the sheriff's office aren't wearing masks, so we ought to do our own house before we go outside and go to other people requesting that.
And you're saying they're not wearing it in-house over there?
No.
Okay.
No.
Well, yeah, my question definitely is the enforcement side of it, number one, I
Right.
guess. And number two, because we typically, as a county, are responsible for the unincorporated parts
Right.
of Black Hawk County. So to me, then the cities, as home rule goes, and the local jurisdictions would be the ones that would take responsibility for their cities and have to approve something similar. Or I guess I don't see Black Hawk County, even though we can speak for Black Hawk County in some areas, I don't see that we can ask for this to be done countywide.
Right.
So without the support
But-
or without the position of the cities.
But since, and maybe this is because it's a public health regulation and we have the county public health board, so that is a part of their jurisdiction, would be my understanding. I believe that was the logic in Johnson County.
This is definitely something that's within Board of Health jurisdiction. The question that I understand it from Supervisors White and Leyland is not a question of jurisdiction for creation of this law or even a question of jurisdiction for enforcement. If I understood the both of you correctly, I believe your question was as to whether it's realistic to enforce it or whether it's practical to enforce it. Did I hear that correctly?
That's my
That's where we're going to be.
And that is something I can't answer. The way that they would enforce it would be through law enforcement. How that works on a practical level is really, that's more a question for law enforcement, I think.
I wouldn't want to see anyone from our health department trying to enforce this, just from what I've seen from different places where I've been, where people aren't wearing masks and you say something to them, it becomes confrontational right away, and it can only escalate from there. We had the event this weekend over at the park. It went well. There was people, and it's outside, so we're a little bit safer, and there wasn't a gigantic crowd, but we requested that they wear a mask. There was people that refused to wear a mask. And I had a couple of girls that were working on one side as they were coming in said, you must put them at, I said, don't get confrontational with them. Just if they want to go in, let them go in, because we don't need that problem. We don't need a confrontation. Maybe I was wrong there, but they were, as far as I was concerned, they were far enough apart. And people did stay socially distanced apart there.
Yes.
I've been following this pandemic closely, and I've been going to many different sources to try to keep myself educated. It is an evolving monster, and I call it a monster. That's what it is. I think many of us now know many people who have had it. I have several friends that have had it. What is surprising me is it took several days to get the results back. In the interim, none of their family members got it, which I find just odd. That's how weird this monster is. This past week, I know an addict. She likes to hang out at intersections and beg for cigarettes, beg for diapers. She wanted a ride. I picked her up. She's a marginalized citizen. She had no mask. She got into my pickup truck. I rolled my windows down. My fear is somebody such as her being cited for this. She's been cited for trespassing several times. She doesn't have the means to pay her fines. So this marginalized person is further marginalized. My brother has terminal leukemia. He wants me to take him fishing in a week and a half. I'm taking him fishing. He understands the risk. I understand the risk. We do foster care. Foster children come and go. We don't wear a mask in the house. I see a significant problem with enforcement. I've experienced it at the front door of the courthouse. A gentleman came in, did not have a mask. We told him he couldn't come in. Well, by God, he said he's coming in. So he came through the metal detector and decided he was going to walk through and exit out the door. At that point, we had to decide when are we willing to have a confrontation with this guy? Well, we decided we'd let him come in, let him go out, but if he was going to come further into the courthouse, we were going to take action. We'd have to protect the employees in this building. My daughter works at a grocery store. It's comical that she has become an essential employee after I served 30 years in law enforcement. I'm glad that store has a policy to wear a mask. But I, as an elected official, as a government official, will not support a mandate that masks be worn.
And if he said, did you? Sweet.
I got a question. The only thing we're doing today is supporting a proclamation to the governor. Is that correct?
No.
We're not taking that action today.
We're not discussing that today.
No, this really today is, we had talked about being open and above board and making sure that there was unity in knowledge. And we are sharing with the Board of Supervisors today much of, what we talked about last week about being open and us knowing what the other one is doing. And so the Board of Supervisors is not being asked to take action today at all. This is informational for the board.
Okay, thank you.
I am still, I say, from the enforcement standpoint, when we're looking at police officers and sheriff's departments, obviously, to do this, I think we certainly need to have those communities on board, those jurisdictions that are actually responsible for those individuals, rather than, I know maybe that's part of the educational piece that I'm missing, that maybe we can engage them by doing this type of a regulation, but I think it's only as good as the enforcement or as the communities that support it. So quite honestly, if we have a lot of holes in the system, I don't see that we're accomplishing what we really are setting out to do. And I don't want it to be an action that we would take and be just one more action, one more thing that not just makes us feel good, but says, hey, this is what we want everybody to do, but we're not going to enforce it. And I don't think there's some of the people I do think that are strong believers in not wearing masks. I don't think the misdemeanor charges are going to stop them or prevent them from not wearing masks anyway. I think they'll just continue to do the behavior that they've done, maybe even take a stronger stance. So I would like to see us work through this and how we can do it or how we can accomplish it, and I'd like to know our communities are supportive of it as well.
I myself feel as same as Dan, and housing two young men from California, California all summer for the baseball. We had no problems with. They're in their last 2 weeks. The one left this morning to Kentucky to get back to school, so he's got 14 days quarantine before he starts school. But I seen more problems out there, just in confrontations, like they had the different roads marked off, and I seen somebody call the courier on it, and didn't read the answer because I knew it wasn't going to be, there was going to be there's no enforcement possible on it. So you're just being gracious. I've told everyone in here about the first time in the grocery store when I had mine on. I was called everything but a human being and said I was a sheep waiting to be slaughtered because I was being led to slaughter because I was following rules that are stupid. But I agree that we should be wearing masks. But I'm with Dan. It's intrinsically impossible to make everybody wear them because and all we're going to do is put a wedge in our community deeper. I feel, I could be completely wrong, a deeper wedge between the people that are for this and the people that are against it. The people that don't believe this is an epidemic, or they just believe it's a farce and all that. They believe what they're reading.
I do have,
I've got
a
a question, if I can ask it.
Go ahead, Tom.
Are we in agreement as the Board of Supervisors that regardless if the Board of Supervisors passed anything, it'll be strictly for the incorporated area? Is that correct? We have no authority over any government entity like the cities, the various cities throughout the county.
Yeah, it'd be up to them, Tom, right?
So if we passed anything, it'd be for the unincorporated area only.
And can
Is that correct?
Go ahead, Mike.
In my opinion, it would actually be enforceable within the incorporated areas. Generally, Board of Health regulations are enforceable in town and in rural areas alike, so I don't see any reason this would be any different.
See, my feeling on it, Mike, is the health department has the authority to do it countywide. The governor can overturn them, but the health department has authority to do it. The Board of Supervisors, in my opinion, don't have the authority, only in the unincorporated area.
And as far as, but the supervisors do have authority to either approve or deny a Board of Health regulation under Chapter 137. It's got to go before the Board of Supervisors and be approved on motion or resolution by the supervisors in order to become a health regulation. I don't think by virtue of that process that the regulation becomes something enforceable only in unincorporated areas. I believe it is enforceable in incorporated areas. And so when we talk about law enforcement and the reality of enforcing this, I think when we talk about getting those people together, I think they also include city police departments. And in fact, the Board of Health is, they have a policy that requires, or the health department and Board of Health has a policy that requires them to notify interested stakeholders when they have this hearing, and I think some of that's going to be going on if they do it. So I think perhaps this suggestion is extremely valuable because it's obviously they would be one of the stakeholders in this. But in response to Tom's question, it's my opinion that it is enforceable in the incorporated areas.
Right. No, I know, Nafisa, you've been waiting.
Yeah.
Dr. Cisse Boignet, Blackhawk County Public Health Director. So I think there's lots to talk about, but I just want us to not be also stuck on enforcement. In public health, we call it behavior change. We have citations for jaywalking, for example. Do we see the police going around looking for people that are jaywalking? I don't think so. I think one of the things that I can share with you all is that we have businesses, for example, that are losing customers because they're not requiring face masks. And we have those that are losing customers because they are requiring face masks. And I think it's the responsibility of the Board of Health and the Board of Supervisors to say, this is what we think is best in terms of implementing those safety measures for our community. That takes off the heat from also the business community. We've been asked to enforce social distancing. So we're talking about a mask ordinance, but yet the state has asked us to enforce social distancing in bars and restaurants. I mean, we can have an argument back and forth that this is not a realistic thing either, right? But that has been asked of us. So I think it's really important that we look at solutions and more the barriers to that solution. We are reaching a critical time. I think having one of the things that I can say that's very important is the face masking in business sectors. You know, when people are going to Target, when people are going to Walmart, all these different things, especially in areas where they can't socially distance. Now, if you're at home barbecuing, you know, or you're fishing and you can socially distance like 6 feet apart, we're not. I mean, those are examples in which really, realistically speaking, we're not going to go and say, oh, you two are, you know, socially distancing or whatnot, and you have to wear a face mask. So I think it's a practicality, and I think that it's important that the community knows, because some of the requests that we're getting is the health department going to also do this? You know, we do have, I think, community support in us making sure that we're implementing the best measures possible. Schools are reopening. I have to share, there's a lot of anxiety. There's a lot of fear. We are getting calls. I mean, we are seeing our comments, and people are concerned. And so for us to present, I think, this discussion of ordinance is because we're at a point where, you know, we can't wait for the state anymore. We have to look at what is best here locally. And so I don't want us to really get stuck on conversations around enforcement when I think there's strategies to do that. It's more about, you know, how do we even support the sectors that really social distancing is very difficult, and yet face masks are not being required, you know, and that can be very problematic. And so I think that there's ways, and I appreciate Supervisor White in your comments about, you know, the difficulty around enforcement and people getting upset. But I think also is because there's a lot of confusion, right? When you're making, when you're asking for people to implement measures, and these are recommended guidelines, I mean, there's a lot of confusion, and we went through that a few months ago where people are like, what does recommendation mean? Do we or do we not? People want to know what they need to do to protect themselves. And so I'm just asking you all to really have that that space in the sense of, you know, what are some of the solutions and what would enforcement look like? And I think we can really have dialogue around that. That I don't want the conversation around enforcement to stop us at looking at what we need to do best for our community.
Well, that's a good point. My question would be, I guess, as we talked last week a little bit about education being a strong component of this, that before we would make regulation, what are we doing, I guess, to educate the population? And what are we doing to, rather than a regulation or requiring it, what are we doing and what is our strategy, I guess, for taking steps to reach the businesses, to reach people that are maybe on the fence? I don't know. I think people have taken a pretty strong stance which side they're on, and I don't know that they'll budge much from that. But I am very fearful in the next few days. We have the population, probably thousands of students returning to UNI. I know there have been multiple bars closed and opened. I know people close to me even that go to those bars regularly and are all over the place not social distancing and doing those types of things. So we have 10,000 more people coming to the community. They're going to be the people that are in those bars, not social distancing, not wearing masks. They'll be the same people then that are at the Walmarts and the grocery stores and all of those locations that intermingle with all of us, with masks on or not. So the danger, the threat of, you know, increased danger to all of us increases, I think, with just that step, let alone the school starting. So I am very concerned about that. But again, mandating masks, I don't think, and I do think enforcement becomes a part of it, because if I'm going to never get a speeding ticket, you know, maybe I'll get caught, maybe I don't, but 90% of the time I speed and I don't get caught, that's a risk I take, and so what? It's the time that I get caught, the time that I have the fine, or the time that slows me down a little. Doesn't mean it stops my behavior or changes my behavior. but it maybe makes me slow down for a while. And so enforcement, I don't want to get caught up on that it has to be either or as well, but I need to know what we're going to be doing, I guess, before I just say, yes, let's pass this regulation and work on it later.
Well, and,
Does that make sense?
And a lot of what you are saying, Supervisor Leyland, can be done with education. One of the things I was just thinking about with so many of our laws, we don't wait to see what people think about them before we say, okay, this is a crime or that is a crime. We say it's a crime because it's the right thing, because it is a crime, because it is harming the public. And so we do not allow the masses to dictate what is may be the right thing for the people. And I think that for me, that's where I come down. It's like I see somebody running and a group, and there's a cliff, and they're going to fall over that cliff, and I just stand there and say, well, they want to do it. That's their independent. No, I have a responsibility to say, hey, there's danger here. And I have a responsibility to warn, and I have a responsibility to do what I can to stop it. And I think that's what we're saying. And there are exemptions. Some of the things that you were mentioned here, they come under some of the exemptions. Some of it is common sense kinds of things.
Well, yes, along the line of, I don't know how you'd ever, like you're talking about a bar, there's no way in hell that you're going to be able to enforce it in a bar, because you don't have a mask on in the bar. You're in there to drink and socialize. At a restaurant, you're in there to have supper. You waste more time putting it on and off. That's why it's nice to see the people at these downtown restaurants right now. Most of them are sitting outside where they can get the fresh air too, which we've talked several times. Dan and I have talked a lot about the outside. You're a lot safer outside than you are inside. I think that's why Walmart and some of those places that are enforcing these face masks a little bit stronger now are a little bit safer to go into. It is, my son and daughter-in-law are at home in Owine with COVID right now, recovering from COVID. They don't have it bad, but they've got it bad enough that they're not able to work because of the way they feel. They said they're real tired and some other stuff going on. And my grandson lives with them, and he's doing fine. Mm-hmm. But it's a younger generation too, and I hear that the way it affects the young kids too, it's scary about what it's doing to some of the young kids' brains and their hearts. So. And
all of that comes like with education. Right. It also comes with us speaking up. We talk about businesses, and Dr. Nafisa talked about some businesses are losing customers. If I go into a restaurant, and this has happened, and the servers are not wearing masks, I speak to the manager, and I let the manager know I'm not staying here, and this is why. I've done that with grocery stores, and I've had even one grocer call me back and say, we've thought about it, we've talked about it, and we will be wearing masks. Please come back. So it works both ways, but right is still right. And I think that as leaders, we have to do what is the right thing and the best for the people.
I want to thank the Board of Health for taking time I'm speaking right now.
I'd like to say one more thing, Chris, on the ordinance part. As an elected official for 27 years, I've dealt with quite a few ordinances, creating them, changing them, and passing them. And the rule of thumb on an ordinance, whether it be for a city or for the county, is it enforceable? If it's not enforceable, then the rule of thumb, you don't pass it as an ordinance. You take it as a resolution. There's money involved with an ordinance, publishing it and going through it, but the key word is it enforceable? And a lot of time there's ordinances that come up. If you put a dollar amount for fining somebody, that's enforceable. You can fine them X amount of dollars. But that's the key to an ordinance that I learned over 27 years as an elected official, is you pass an ordinance, the language in there, is it enforceable?
Thank you, Tom. I just want to thank the Board of Health for starting this process and demonstrating the leadership that we need in this state right now, because it's been clear this whole pandemic, this leadership's not going to come from the governor. We could pass proclamation after proclamation, and it doesn't matter. We send them on to Des Moines on any issue, but especially COVID, and it goes nowhere. And the public is looking to local government to be their voice and to protect them in this moment because the state is failing us. And so I agree there's going to be all sorts of hurdles to get around with this, but I think this is the right action to take, and I appreciate the Board of Health being willing to step up and start this process.
Thank you. Thank you, Board.
Thank you.
One more thing, Reverend Mary. Did we discuss a date with the Board of Health as to a public hearing? Or did we arrive at a date for next week?
I was thinking you were saying Wednesday, we couldn't have it before Wednesday.
It couldn't be before Wednesday, should be by Friday sometime.
And so I think this week.
Next week.
Yeah. And so we'll hold to make sure.
Okay,
that we have
all right.
a quorum.
Because
And
we
that
need,
was one of the reasons I didn't respond, because we need to see about our quorum.
all right, we need to have that by, preferably by tonight, just to get the notice published soon.
You got it.
All right.
Thank you.
Thank you.
All right, thank you. Do we have anything else on this item? Move on. Does the Board of Health wish to adjourn their meeting at this time?
I want
Send them
to
adjournment.
thank all the members of the Board of Health for attending today, and we are now at the place where I will entertain a motion to adjourn our special session.
Dr. Royce, I move adjournment.
I second.
It's been properly moved and second. Is there discussion? Hearing none, we are adjourned. Thank you and have a great day, everybody.
Thank you.
Thank you.
All right, we will move on to another business. Is item B. This is a motion that the personnel requisition for administrative aide 3, that's full-time in the Board of Supervisors office, be approved.
So moved.
It's been moved. You have a second?
Second.
It's been moved and seconded. Any discussion or questions?
I'm going to vote no symbolically because
Can't do it.
I hate to see Dana go.
All those in favor?
I was just gonna say
Doesn't
that
count.
if you could just vote no, and then she doesn't have to move, that would actually make my job a lot easier, so.
Might not.
Sorry, Rory, but it's just not gonna happen.
Yep.
All right, all those in favor say aye.
Aye.
Aye. All those
Aye.
opposed?
Opposed.
The ayes have it. Next is a motion to approve the location of a drop box for electronic purposes near the entrance of, or election purposes, I'm sorry, near the entrance of the courthouse.
So moved.
Second.
So moved and seconded. Any discussion or questions?
You
Mr.
want-
Chair,
yeah.
Yes.
I would like to make some comments on this. There has been a lot of interest in this subject of whether the mail is going to be affected for the fall election. And so a number of counties around the state have started installing drop boxes for absentee ballots and for other mail that's directed to the election office, like absentee ballot requests and voter registration forms. The more that I hear about this subject, the more worried I become because there seem to be efforts to slow down the postal service, which could have a very bad effect, first of all, on the election conceivably, but also on public trust in the absentee ballot system. So we are going to be talking about not only establishing these drop boxes, and this action is for one, but I may be back to the board asking for additional ones. And also we're going to be looking at other ways to make sure that people can get their absentee ballots back to us safely by not necessarily just using the mail, but by possibly voting at satellite voting locations or having people assist them in returning ballots. So I just want to have that in your mind. We'll probably be bringing other aspects of that to you in the future.
Great. I appreciate you making this effort. The post office, which is an agency that actually predates the birth of this nation, is really under attack right now. And just this last Friday, you may have heard the reports of the Friday night massacre where a number of the career officials were let go. And it's really sad to see the politicization of America's oldest governmental agency. And so we do have a motion and a second. All those in favor say aye.
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 Greg, do you have a location in mind?
Yeah, that's something that I wanted to discuss with the board as well, and also with Rory. We would want it to be close to the entrance of the courthouse. We would want it to be in view of security cameras. But, you know, specific locations, how things work out with the flow of traffic and that sort of thing, we would want to make sure we have advice from building maintenance.
Seems like right inside the door down there in the one corner, you know, that way they wouldn't even have to come in. They could drop it off and go right back out and not have to come through.
We're hoping to have.
What are
it
you gonna do when the
outside.
doors are locked?
Yeah.
Oh.
Yeah, we would want it outside the building, but close to the entrance. There are people who have expressed that they would like to avoid coming in the building at all and be able to drop it off.
Very good.
Okay, thank you.
Well, the ayes have it on that motion. Next is a motion that the appointment of Joy Briscoe to the Blackhawk County Veterans Affairs Commission be approved effective August 11, 2020, with a term ending on June 30th, 2023.
So moved.
Second.
So moved and seconded. Is there anybody wishing to speak?
She
I
was,
think Glenn probably does.
Glenn, she was online. She was on earlier, so.
He's there. He was right there. He was where
Hi, Glenn.
Ryan is at. Maybe.
Hello. I just wanted to speak about Ms. Briscoe, and I do want to thank the Board of Supervisors for assisting us in the interview process. I know Supervisor White helped us through the whole process, and Joy comes to us as I believe it's either a 15 or 16-year veteran of the United States Air Force. She left the Air Force as a non-commissioned officer. And she brings a wealth of experience. She does work for the Waterloo School District. She has served on multiple boards and other community organizations, so she does understand the role of oversight. And also, we do now have an Air Force member now on the commission. So at least we have somebody who knows how to play golf out of all the commissioners. And Joy is she's a great veteran and a citizen, so we're really excited about having her on the board. And again, I do want to thank Supervisor White for helping us during the interview process. And I know she was here earlier on the meeting, but unfortunately, I know she had some mandatory meetings at the school district regarding our return to learn plan. But she comes highly endorsed, and it was a unanimous vote to push her forward as our next commissioner. And we do want to thank Elizabeth Clark for her many years of service on the commission, helping out in various projects, and a great veteran, and still continues to give back to the community. So she will be filling Elizabeth Clark's position.
Excellent. Very good. We have a motion and a second.
Dan has a question.
Oh, go ahead, Dan.
I serve on a nonprofit board with Joy Briscoe, and when I saw this appointment, I was excited to see it. She adds a lot of energy, optimism. She's a go-getter. I'm excited for this appointment.
Excellent. All right, we have a motion and a second. Any further discussion or questions? Hearing none, all those in favor say aye.
Aye.
Aye. All those opposed? The motion carries. Next is a resolution that the bridge embargo restoring vehicle and load limits to the maximum legal limit. The structure FHWA number is 73910 crossing Rock Creek, located on King Road between Bishop Road and Main Road, be approved, and the removal of the signs from the structures as recommended by Catherine Nicholas, County Engineer.
So moved.
Second.
So moved and second. Kathy.
Yeah, I just wanted to say that this is, we just finished replacing this structure on King Road. It was posted in September of 2008, and with the new structure being open, I would like to remove that embargo. I would like to show you some photos of the before and after photos of the bridge, but I think we'll wait until about probably a month from now. We're just finishing the paperwork and closing out that project. When we come and ask for a final acceptance, I will show you some photos then.
Very good. Thank you.
Thank you.
It's been moved and seconded. Any further discussion or questions? Hearing none, roll call, please, Mr. Veeder.
White,
Yes.
Leyland,
Yes.
Little,
I
Trumka.
think
Yes.
oh. He's muted. No, he's not.
Yes, yes.
Yes.
There we go.
You didn't call my name yet. Yes. The resolution is approved. Next, item F. This is a resolution to direct the county engineer to proceed with the vacation of excess right-of-way pursuant to Section 306.10 of the Code of Iowa, and that the former primary road number 57 right-of-way vacation located at that part of the southeast quarter of Section 31, Township 89 North, Range 14 West, on the 5th p.m., Blackhawk County, Iowa, described as followed.
So moved.
Second.
Yes, we moved and seconded. Kathy?
Yes, thank you again. We received a request about a year ago to vacate a portion of University Avenue, and this is way out in the western portion of the county, in the Butler-Grundy, Blackhawk County, that area, the four-way stop out there. So I wanted to walk you through the process, and hopefully you'll pass a resolution for this. Next slide, Kim. So the property that we are asking to be vacated is, again, located in the very western portion of the county, the very west end of University Avenue. You can see that I have highlighted the area in yellow that has been asked to be vacated. A number of years ago, we placed a barricade on this portion of University Avenue, and access has not been accessible for probably 30 or 40 years. This portion that's in yellow. Next slide, Kim. So again, we did receive a request from Khalid Anderson, who lives in the home on the southwest portion of that slide. His mother lives across the street. He asked if we would vacate the property. I believe that this was at one time probably maybe acquired by the Iowa DOT years ago. I'm not entirely sure, but at that time, at some point, it was turned over to the county, to Blackhawk County, and we retain an easement on this property. Again, we did place a barricade on this section of road. I don't know when, maybe when it was returned or given to us as the county. So it's been that way for a number of years, but it is still public right-of-way for county highway purposes. Again, Mr. Anderson asked us to vacate the property about a year ago. We determined that it was probably in our best interest to do that. It's just a vacant piece of roadway sitting there. It's essentially a liability for us. It's been barricaded for many years. Our snow plow in the winter comes up to the barricade, plows the road to get there, and then turns around in Mr. Anderson's driveway. So it's clearly not being used by any taxpayers, any residents. Mr. Anderson is the only one really coming and going into that property. He did request that we vacate it. His mother has indicated that she would like to turn her portion over to her son, Mr. Anderson. And that would be the way the easement law works. When we relinquish our easement, it goes back to both, from the center line, it goes back to both sides of the property owner, is the way the easement is written. So in speaking with Mr. Anderson, I asked him we would need a survey, a legal description of that property in order to do the vacation. He did hire a surveyor, and we have supplied you with this legal description that's in the resolution. The surveyor supplied that, and he paid for it at his expense, Mr. Anderson did. Next slide, Kim. So in following Code of Iowa, the vacation process, we receive our guidance from the Iowa Department of Transportation. They indicate that if a property or a vacation consists of a roadway that is not used, we are not using this existing way as a traveled way, that this vacation can be done without having a public hearing. If you recall, that's the normal course of events, that we advertise and we host a public hearing. But that is not necessary in this case because it is not being used as a traveled way. It has been barricaded for years. The county, we are to look for any damages that may occur. We have heard none of this from Mr. Anderson. There's really no reason that there would be any damages. He is still having access to his property. Of course, the utilities would still be, if there are any, would still be granted. They would still retain their right to be in that right of way.
Kathy, for the record, is it Caleb Christensen?
Yes. Yes. And I believe he is with us this morning if he would like to say anything. But other than that, I can answer some questions, but I would ask that you pass this resolution to vacate this property to Caleb Anderson.
Hey, folks, do we have any questions? Do we have a motion on the floor?
Yes, we do.
All right. Hearing no questions or further discussions, roll call, please, Mr. Veeder.
Leyland?
Yes.
Little? Trelka?
Yes.
White?
Yes.
Schwartz?
Yes. The resolution is approved. Next
Yes.
is...
Yes.
Right, yes. Thank you.
Try to stay awake, Tom.
Next is discussion, current revenues for the county engineer's office with Kathleen Nicholas, county engineer.
Thank you. So I've given you slides I have 6 or 7 slides for this portion of the presentation. I believe I gave those to you yesterday. I know some of the numbers are pretty small, but we'll try and answer your questions as best we can. So I first came to you back in May when we had received we were hearing outlooks from the Iowa Department of Transportation. Next slide, Kim. Thank you. About what was happening to road use tax funds due to COVID, the pandemic being with us. And at that time, the DOT was estimating that it may be possible to see reductions of $100 million to the road use tax fund. And this would be statewide. And at that time, none of us were sure how long this was going to go on. We still aren't sure of that. But the Iowa DOT is estimating that June through October of this year, reductions in the road use tax funds to COVID will be $100 million. They have given us that guidance as recently as June. They're telling us they're going to give us updates every month on a monthly basis from now until the end of the calendar year. Their guidance is telling us, counties and cities, to assume that we are to receive roughly a 20% reduction in road use tax funds over this time period from now until the end of the year. And then they're estimating that the revenues will be reduced November of this year till June of next year of 10%. That's just what they're forecasting and what they're telling us. Next slide. So I wanted to go over some budget numbers with you to let you know where we think we stand, because we would like to make some large purchases. So in looking at this spreadsheet, we have 4 columns there, our 2020 budgeted columns, and those revenues were of course based on DOT forecasting, their regular methods of forecasting, and they were provided by the DOT and then by James for the general basic and the rural basic funds. We of course budgeted that, you approved our budget, and that's the way we proceeded through the year. So in column 2, we've now been able to put together and show you our 2020, our actual numbers for revenue and expenses, because of course the fiscal year ended on June 30th. So Carol's gotten all of our numbers together. And you can see that the road use tax dollars, the $4.414 million, those are about $500,000 higher than what the DOT projected for 2020 fiscal year. Time 21 was very close to what they projected. And of course, the general basic and the rural basic funds were spot on to what was projected. And so you can see that our total revenue in our actual FY20 budget was about $600,000 higher than, $1.37 million higher than what we had budgeted. So that's going to go into our fund balance. And then you can see our expenses, what were actually spent was less than what we had budgeted for 2020. And part of that was because COVID was already starting to take effect in March, April, and May, and June, so we did cut back on some items, on some expenses. So in looking at our FY21 budgeted numbers, this is what you approved in March, so this would be the third column. That $4.072 million of road use tax fund money, that's what the DOT forecasted to us back last fall, and those are the numbers we're using. James gave us the numbers for the general basic fund and the rural basic fund. Those are the numbers we inserted into the budget, and then you approved the budget at $8.1 million for revenue. And then you'll see that we did come to you for requests of $841,000 worth of capital equipment for FY21. In general, our operating expenses increase, and as well as salaries and benefits. So that's how we came up with the $8.2 million of expenses. So I wanted to look at the last column now, and this is taking those DOT projections into account of a reduction of 20 to 25% for the remainder of the year. That's how we came up with the $3,430,000 of an estimated FY21 budget. We also likewise did that the same for the Time 21 dollars. However, the general basic fund and the rural basic funds, we're keeping those the same based on recommendations from the finance director and the fact that we've already budgeted, you've already approved the budget. So we did reduce our FY21 budget to $7.6 million based on all of those DOT forecasts. And looking at the last 4 lines there, we're going to try and cut some of our operating expenses so that they're what our operating expenses were from last year, from FY20. And then, of course, salaries and benefits, those will increase. So I wanted to talk to you today about the $574,000 that we would like to spend on capital. Next slide, Kim. So in looking back at the FY20 budget, in ways that we've been cutting a few of our dollars that we're carrying over to the FY21 budget, you can see that equipment and repairs, we did budget $350,000, but only spent $236,000 in FY20. Diesel fuel, we underspent on. We did budget by amendment $1.3 million for gravel, if you recall that budget amendment. And we only spent $1.2 million in FY20. And then we underspent on our capital items last year, and that was primarily due to lower costs on the Gilbertville shop, as well as a lower cost on purchasing the crane. Next slide, Kim.
Kathy, I got a question on your
Yes.
FY20.
Yep, go ahead, Tom.
On the FY20, you were only a few months into your FY20 budget. You came to for a budget amendment for rock and fuel. Is that correct?
We came to you for a budget amendment for
Fuel.
For rock and said it was going to be higher, and that's the reason
Yes.
why those two line items are shown in excess in there. Because we amended the original FY20 budget only 3 months in.
right in December.
Is that correct?
Yes, we asked for the budget amendment in December because we.
That's why those numbers are high. if those numbers weren't, if we wouldn't have done the amendment, they probably would have been right on.
Yes, in the end, by the end of the year,
But we did, yeah, we did the budget amendment just 3 months into your FY20. That's at the time when we did it. If you recall, the record reflects, I thought it was pretty odd doing an amendment that early when you didn't even, when you had all the money still in there yet.
Yeah, the gravel was budgeted at $1 million. So we knew that we were, just due to the conditions of the 2019 spring, we were concerned that we would definitely overspend in rock. And we did. We spent $1.2 million. So the reason I'm asking you or telling you all of this information now is that we would like to purchase several items that have been approved in the FY21 budget. So last March, you approved $841,000 for capital expenses for us. We need to continue to modernize and update our fleet. We would like to purchase a motor grader, a dump truck, and a used loader. And those, particularly the motor grader and the truck, those will take us 6 to 8 months to receive. And this was before COVID-19 impacts to manufacturing. I don't know what the lead time is now. Hopefully it's not too much later. But we would really like to, I would like to replace those, a motor grader and a dump truck. We need to replace those to keep our fleet, to keep the costs down, to get us into equipment that has 8-year warranties at that point is what we can get with a motor grader. I don't want to lose this spending authority by getting these things in next year's fiscal year, which might happen if we don't ask to purchase these now. We might not receive them until after June of next year.
But if you ordered them wait till the end of the year to order them, you'd still get them, or they'd still come out of this budget because you had them ordered.
Well, we don't pay for them until we receive
Till you get them.
Yeah, in the last truck took us about 6 to 8 months to get, and then we pay for it when it's delivered to us. When we're happy with it is generally the way Freightliner and the John Deere have worked. Next year we do have another big ask for capital. I would like to purchase 2 motor graders and a tandem axle dump truck. So those 3 things right there are over $900,000. So yes, we have built up a good fund balance, but I want to be able to spend some money that you have authorized us to spend in the FY21 budget process. Next slide, Kim. So that's why I'm telling you about these items now. We'll continue we would like to move ahead and purchase these 3 items. The DOT is telling us that they're going to give us updates once a month. We don't really get updates on the road use tax fund. We get those quarterly, right?
We're not getting updates from
Okay, so we're getting quarterly updates from the Department of Revenue and the DOT, but we will come to you every quarter, or quarters 2, 3, and 4.
Say again.
I think he's talking to his wife.
And we will give you an update every quarter. And I'm not saying that this is the only thing we need to buy, because we have we had a list of 5 to 8 other things that we need to purchase. But we'll defer some of the smaller purchases with much shorter lead time. For example, CAD computers. Those only take us 3 or 4 weeks to get. So we're comfortable deferring those until December or even next March, whatever later in the fiscal year. But at this point, I would like to be able to move ahead and set a public hearing in mid-September for a motor grader and a single axle dump truck. We would just receive quotes on a used loader because it would be under the $100,000. But of course, we would bring it back to you for your approval of the actual purchase. So can I answer any questions at this time?
No, I appreciate the work that you went to, I think, make this all available to us and explain, I think, where we are. I know early on in the year we were asking you to delay some of the purchases, just because we weren't sure where we were going to be with this. So.
How long was your workers off for this? You know, how many weeks were this equipment sitting around?
So the secondary roads employees had, when you first issued the stay-at-home order, they had approximately 8 days off. And by that third week, our guys were pretty much back to work full-time. And we can get you the payroll, you know, because we did code their time as the COVID-19 when they were off. But for the vast majority of those 8 weeks, I believe it was probably 6 weeks, our employees were, the secondary roads employees were working.
So what would it hurt to wait till October 1st to come back with updated projections so we knew a little bit better? Because by then we might know exactly where we're standing for COVID, whether it's getting worse or getting better. We could be on another shutdown by that time.
I think it's going to be next spring before we even have a good handle.
Well, yeah.
Because we're not through this COVID.
So I did mention that we have a healthy fund balance, and we have a fund balance of $3.9 million. So
and that's because of some of the monies you didn't spend, right? The monies you just showed us, right?
Right. So
and they might have been spent if the 0.1 million rock would have probably been spent because we'd have been putting down more rock than we did.
Well, in FY20, we put down as much rock as we felt we needed. We did as much mile rock as we would do in a normal year. It was spot rocking.
We put way more than we usually did.
Spot rocking took.
And the price is going up too.
Yeah.
So you got to add that in.
Right. So that's why we budgeted $1.3 million for gravel this year in the FY21 budget that you've approved. So we're not, we know we're going to spend at least $1 million, but we're not sure yet. We still have half the fiscal year to go.
Yeah. Kathy, did you say you had a $3.9 million fund balance?
Yes, $3.8 million fund balance.
And out of that 3.8, did that be used for roads or money towards the bridge we may be bonding for shortly?
So that would include local construction, could possibly be used for local construction, but it doesn't include, it includes some of the roadway project construction. Yes, Tom. Yeah.
Okay, what are we going to be done for here pretty soon? Is that for the bridge or was that for the Grundy or we're going to be doing a bonding project here shortly.
Yes.
What's that for?
It's for Grundy Road, the grade and paving.
How much is that? Do you recall?
It's approximately $4 million.
Okay, can some of that 3.9 fund balance be used towards that so we can bond for less?
So I guess that would be another question. I guess that would be something that we could, we'd probably want to run some different numbers for you to consider that type of scenario. James, do you want to say anything? Or?
Yeah, that would be an option. The one thing to kind of keep in mind, though, interest rates right now for bonds are insanely low. When speaking with Maggie Berger, she had sold bonds probably about 2 weeks ago, and they were under 1%. So, in my opinion, it would not be worth using fund balance in case of emergencies and situations like that, because when we are in a position where we are going to bond, then we might as well take advantage of those low interest rates. So, as it is an option, I would recommend not doing it.
When do you plan on bonding, James? When do you plan on bonding for this?
So we're actually going to have a conversation next week. John Foster is going to be coming up to you guys. He would like to come up with an ask, and that is going to determine when we are looking to sell bonds. Ideally, we're going to sell bonds late October before the election. When speaking with Maggie Berger, she had said that the election is really going to increase in interest rates, maybe not significantly, but just enough to the point where on, potentially $8 million worth of bonds is going to be quite the increase in interest. Not to mention, we have 2 bonds out there that are up for refunding. So if we include these in the if we include those bonds and refinance those in with the current sale of the bonds, we have a opportunity to save quite a bit of money. So that is all going to be something that we're going to discuss here in the next coming weeks. But ideally, we're going to sell bonds late October before the election.
And I would assume that 3.8 fund balance is much like our fund balance. It's good to have a certain amount in there for projects, for whatever needs are out there, so you don't want to spend it down too much either.
Correct.
Okay.
So,
I guess, Kathy, I'd like to see you move forward, especially with the motor grader, because my concern is with brakes and supply chains that are happening in everything right now, and that you've got 2 scheduled next year, that if it ends up being even much longer, we could really delay by a number of years eventually when we're trying to replace this fleet. And so I appreciate all the information that you presented to us today.
Yeah, and I liked it as well, just when you're looking at the motor grader and dump truck for the most part, and then reevaluating and seeing what it looks like for the rest of the year, and if there need to be changes too, because we do need to continue to work and do county work and get county work done. So, but thank you for this.
And I should say, none of us have a crystal ball, but we know that much of the road use tax fund, I don't know what percentage of it is diesel fuel, but trucks have not stopped running. In the certain aspects of the economy, I believe, will continue to run. And so that the DOT seems fairly confident that a 25% reduction in the road use tax fund over the next 6 months, that hopefully that's like a worst case scenario. And of course, like I said, we don't have a crystal ball, but we do have the fund balance in case, for whatever reason, the DOT doesn't, the gas tax does not come through for us. But
So when were you thinking of hearing? If you,
So-
I guess we didn't object, I guess.
we need a week or 2 to get our specifications together, and then we were thinking maybe set the hearing for either the first or second Tuesday after Labor Day in September, the second or third week in September.
Okay.
The motor grader and the truck.
I don't think you're going to have a problem with getting that equipment myself. They're calling people back to, Deere just, not that you're going to buy a Deere, but Deere just called a bunch of workers back from their plant that manufactures that stuff. The new plan they have, even for tractors, is working well for them, so I don't think you're going to have a problem.
You mean shorter than 6 to 8 months or
They
whatever
got
you think?
people.
Yeah.
Yeah.
The graders
On
have
demand.
been, the graders they've taken about 4 months. They don't start making them until we
Until you
order
order
it.
it, yeah.
Yeah.
It's the trucks that, there's so much coordination because we buy them with the snow equipment on it. And we have to work with, or we don't, but the Freightliner, assuming we get a Freightliner, has to work with that vendor to get the snow equipment on it. And
Yeah.
that's what usually takes a month or 2 extra once it's built.
Okay. The additional
Thank you
time.
for all that information.
Yes.
Yeah,
Thank you.
Thank you.
All right. Do we have any other reports or information from the board today?
Greg.
I just like to report or send out our condolences to the Bob. Yolanda was talking about the Vietnam vet. Bob Toit's passed away, a local rider for the Cedar Falls Riders, and my cousin's grandson was killed in a motorcycle accident last week, and I went to his, Matt White was killed in a motorcycle accident, so I went to his funeral. Also like to thank everybody out there that had, I'm trying to think of the right term, that was gracious enough to come down and attend a very nice event honoring veterans. Blackhawk County and as a whole ought to be ashamed of itself. I realize COVID's going on, but I see hundreds of people walking into bars on a daily basis when I'm out walking in the morning. I see people going everywhere, but they don't have enough respect to honor our veterans. Shame on you.
Dan?
I just wanted to update the board. I had filled in Craig a little bit on this, and Supervisor Little in regard to. I had a resident from Washburn contact me. She's been down there about 6-7 years. She had water concerns. I went to Kathy Nicholas. Kathy gave me a fantastic education on what has occurred over the past decade. So I got myself up to speed. I went to the resident. I explained it all to her. I've met with her twice. 10 years ago, we didn't have Facebook. She represents an informal group that would like to address this problem. So I took the documentation down to her. I talked with her. She's going to see if people are interested. Now, this problem can be fixed, but it comes with a cost for the residents of Washburn. So she's going to see if there's an appetite for it, and if there is, I will bring it back to the board like it was in 2011 and 2012.
Was she going to utilize the Washburn committee or board? I think there's a board.
Yeah, they do have a committee.
They have a board
Yep,
that's there? And
I made her aware of them.
I don't think they're very active anymore, though. The people that were on the board, several of them have passed, and several of them have just lost interest.
But I thought we did
one
get-
gentleman is still heavily involved, but there's people down there that are concerned.
I thought there was 2 new ones that were added, I think.
Yeah, there is. So there's a
Wasn't there?
gentleman, yeah, I can't think of his name off the top of my
No.
head. But
So
yeah,
I will.
he's been in several times to talk to us.
So
about
they were going to
different
get
things.
together maybe and then decide.
And I will
The
wait.
Dan, the county did a study on that just a few years ago. This is about $3 to $4 million.
Yep. Yes, sir.
Maybe they're willing to pay the cost, yeah, that's true.
Great, well, thank you, Dan.
Only comment I'd
Yes.
make is I think all the board, I sent the email out that the UCC legislative wrap-up will be next week, that they'll be here for a short time and they'll do it through Zoom. But the one thing I wanted to bring up, and I think it's sometimes because we're all in the office at different times, is the interviewing for the planning and zoning board members. I think there was 2 that we needed to look at, and there was an individual that contacted us that possibly is interested in the Board of Adjustment, I know in the last couple of days, but I didn't know if there was anyone that wanted to interview. I'd be willing.
I'm happy to participate.
Okay, and Zoom or however
Yeah, I
you
think
want to do it. would be
do
good.
Zoom.
Okay, great, we'll set up something then, thank you.
Hey, yeah.
Also, I did forget one thing. Sorry about that. I wrote it on the back. I just got the email a little bit ago. I'd like to congratulate the kids from Don Bosco that were made All-State for baseball. Cale Frost at shortstop, Lewis Tavel at pitch, and Ryan Naughton outfield, and West High's Mitch Fordyce as a catcher.
Very good.
Yep, great.
All right, I'll entertain a motion to adjourn.
So moved.
Second.
It's been moved and seconded. All those in favor say aye.
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 Aye. All those opposed? All right, this meeting is adjourned.